there are some structures inside of the leaves that make them undigestible for me as a mammal.
So it's not basically leaky gut we're talking about. We're talking about something totally different. Dr. Mayr, more than 100 years ago, actually, were able to see how gut is important just by observation of the horses and the cows.
What is happening inside of the intestine, if it is now a compromise, if it is now an illness, or if it is now pure health, energetic digestion, is something that is becoming visible from outside. Higher performance of cortisol that is leading to a metabolic change and insulin resistance, or adrenaline, and both are in conflict with my ability, for example, to regenerate, to digest, to be fertile. Wow, fantastic. But why is it then that your body and your mind is such a mess, although you are eating so beautiful things? Because you missed one thing.
I'm Dr. Esra Çavuşoğlu, and I've been living a sober life for the past 19 years. My battle with addiction drove me to seek new methods, devices, and supplements to improve my physical and mental performance, enhance my quality of life, and ultimately live healthier for longer. From my experiences in addiction recovery, biohacking, and longevity to the latest global developments, from groundbreaking entrepreneurs to expert academics, the conversations I've had over the years are now featured weekly on Soberhead Podcast. Welcome to Soberhead Podcast. Today's episode is all about gut health, nutrition, and one of the most talked about medical wellness approaches in Europe. I'm joined by Dr. Sepp Bodo Fegerl, head of medical department at VivaMayr, where he works with an approach that combines modern Mayr Medicine, medical evaluation, and personalized nutrition to help people better understand the connection between digestion, energy, inflammation, and overall health. In this conversation, we break down what the Mayr Medicine actually is, what people often misunderstand about gut health, and how nutrition, eating habits, and the state of digestive system may affect far more than just your stomach. We also talk about what is practical, what is personalized, and how listeners can start thinking differently about their own daily habits. Let's begin. Üniversiteyi sadece dersler, vizeler, finaller olarak düşünme. Asıl mesele okurken kendini keşfetmek, üretmek, projelerde yer almak ve mezun olmadan gerçek dünyayı tanımaya başlamak. Bir yandan psikolojiyle insanı daha iyi anlayabildiğin, beslenme ve sağlık bilimleriyle iyi yaşamanın ne demek olduğunu öğrendiğin, mühendislik ve yönetim bilişim sistemleriyle teknolojiyi, veriyi ve sistemi çözümleyebildiğin bir üniversite düşün. Yani sadece bilgi aldığın değil, düşündüğün, ürettiğin ve fikirlerini hayata geçirebildiğin bir yer. İstanbul Gedik Üniversitesi, öğrencilik hayatını gerçekten yaşarken geleceğini kurabileceğin bir deneyim sunuyor. Ayık Kafa'nın daimi destekçisi Gedik Eğitim Vakfı'nın sağladığı katkı ile size dünyanın önde gelen uzmanlarını konuk olarak getirmeye devam ediyoruz. Siz de Ayık Kafa'ya abone olarak destek verebilirsiniz. Dr. Sepp Fegerl, welcome to Soberhead Podcast. It's an honor to have you in my studio.
Thank you very much for the invitation. Thank you very much for explaining a little bit what I'm about to do.
Sure. To give a little explanation to my audience, I'm sure some of them heard about a VivaMayr clinic in Austria. And, you know, there are a lot of Turkish people who goes there and they share in their social media. But there's a much more than the clinic. Once I invited you to my podcast, and before the podcast, I did a deep dive on the Mayr Medicine. I didn't realize that Dr. Mayr, more than 100 years ago, actually were able to see how gut is important just by observation of the horses and the cows. We're going to come to that. But the most important part of this conversation probably is going to be that for people to understand that there is a fellowship of Mayr Medicine in Germany and in Austria, correct?
Once you are trained and finish your training as allopathic physician, cardiologist, orthopedic, you can start your training and to become a Mayr physician.
Sure. So it's not just the clinic. For the audience, again, they know that I don't promote one institution or the other. This is to explain the theory and the applications, where it's coming from. So let's start with, what is Mayr Medicine?
Mayr Medicine owns its roots in observational medicine initially.
Observational.
And the observational medicine aspect is coming to the facet or to the conclusion that if there is a root cause for health or disease, it is somehow located inside of the intestine. And what is happening inside of the intestine, if it is now a compromise, if it is now an illness, or if it is now pure health, and energetic digestion, is something that is becoming visible from outside. Is something that can be experienced by the client, for example, or also by the physician. There's an alteration in smell, in posture, in behavior, in state of energy, in ability to function and to perform, and emotional state.
Smell, you said?
Of course.
Like how?
Our body is constantly trying to survive, and for that it's important for it to get rid of metabolic waste. Yeah? So we use an outlet,
What the
for
odor
example,
we're talking
the
about?
odor, you use your breathing, but you also use your urine. You mentioned that Dr. Mayr was observing cattle, for example, to change in a beneficial way or not, or during the year, according to what they ate and of how healthy they are. But he moved then also to Paris, for example, where in the 18th and 19th century, physicians already tested inside of the urine metabolites like cadaverines, catols, ammonium to identify those metabolic side products of indigestion. He just brought it to notice a little bit more. He brought it and turned it into a therapeutic concept as well. Nowadays, we are so super excited to test the metabolites inside of the urine again, or in the saliva. He did it by that time.
So my understanding, what you're saying, is that in Europe, actually, end of 1800 and beginning of 1900, they were already doing this. That was a way of deciding if a patient is well or not.
Of course, this is the same thing like your mother already did with you to identify, is it today a good day of yours or not a good day? I smell my partner, I smell my child, and then I can say, hey, can we together conquer the world today, or is it better to be patient?
It's so interesting, isn't it, that, we're now so focused to functional medicine, regenerative medicine, and all these, longevity, and we think that all these things got invented only for 10 or 20 years. Actually, now we're talking about, like, you were looking to kettles, to cows, to horses, to observe. And actually, let me explain what I learned, and you correct me. So, interesting few things that Dr. Mayr figured out just by observation. One is, again, the shape of the belly and the sluggishness and etc., and decide that if the animals are like this between what they eat and seasonal, therefore human would be like that as well. The second thing is very interesting. He was a soldier at World War I, and he observed soldiers who got injured, and because there was a lack of food, that lack of food actually helped injured soldier to heal faster. Like fasting helped them heal faster.
There's currently a very interesting study going on in the Ukraine on the front. We measure the change in the heartbeat rate variability of soldiers that are eating accordingly to what they would think is good for them, and soldiers that are eating the same stuff but chewing it much more. And it's enormous of how the sleeping quality, for example, in the HRV are improving just with this little aspect of chewing.
Yeah, we're going to come to chewing as well, which is, I think, modern world, everything is much faster, so I don't think people are chewing enough. Let me jump in for a very quick second. If you can hear me right now, we know you're watching Soberhead. But are you subscribed? Could you check it for me? Very honestly, our subscriber count gives us real leverage when it comes to convincing the guests we invite to join the show. So, if you want to keep watching some of the best experts in their field right here, please subscribe to the channel. Dr. Mayr believed that almost all chronic illnesses start in the gut. How does modern science regarding intestinal permeability, leaky gut, today's word most people knows, and microbiome validate his 100-year-old theory?
We measure the state of intestinal integrity by measuring, for example, parameters like calprotectin or sonolin, for example, or alpha-1 antitrypsin in the stool, in the urine, in the blood. This is one aspect. And we can observe, for example, state of inflammation in the body, and with it also inflammational behavior, is directly connected to the amount, for example, of sonolin that we find inside of the stool. If you think of, for example, autoimmunitary diseases like Hashimoto disease, a thyroid issue.
Sure.
So many people nowadays in the boiling metropoles of this world are suffering from. Hashimoto disease always comes with an increase of sonolin. So if then with an adjustment in the diet and the adjustment especially in the way of how someone is feeding himself, not with what, but how he is digesting it, those parameters reduce, and performance, cognitive as well as emotionally, is increasing. We nowadays also measure, for example, the LPS in the blood. This is a polysaccharide that is typically found in some bacteria that are unfavorable. If we have a proper intestinal barrier function, we don't find it in the blood. If there is the integrity is lost, we find it in higher numbers, and we know nowadays, for example, that it is leading more likely to a cardiological or vascular event or a stroke, for example.
You're almost talking like you guys don't need, like just by very little, you can come up to some diagnosis. You also explained to me before getting into the podcast, and that's actually, there's a couple of very, very interesting testing modalities. And one of them is the silent diagnosis, which is I'm going to show it's the shape. That's the logo that you carry actually on your chest, on your jacket. So when you look to someone from the back, from the side, and from the front, you're able to diagnose them and decide what's wrong with their...
Perfect.
Yeah.
Today I was blessed to have my breakfast at the shores of Bosporus.
All right.
And there I had my cup of coffee, just one coffee, and I hydrated myself first before that. But I was watching the people passing by. And each person, although I never met them, is telling me a story. Yeah, are they today energetic? Are they not energetic? Do they look depressed or not depressed? And if I break it down of what I really recognize is the posture, the way of how the shoulders are placed, for example, the arms are placed, the pelvis is rotated, the neck straight, high, low, whatever. And those postural adjustments are very, I would say in 90% of the cases related to the way of how healthy is the intestine in this current situation. Is there, for example, a lot of fermentation? Fermentation is coming together with alcohol production that is weakening the muscles, and on the other side with gas production, and gas is always pushing high on from the below on our diaphragm. The diaphragm is the muscle that helps me to ventilate my lungs. So if there's a person with more of fermentation issues, suddenly I can observe that he or she is activating her breathing assistance muscles. That is bringing the shoulders just slightly forward. That is making, for example, them alter a little bit their breathing. The breathing frequency is slowly getting higher, and the breathing depth is getting more shallow. We both, I think, are convinced that breathing is very important because with my breathing frequency, I can adjust and make a difference in the way of how I experience the world is for me. Is it if my breathing is relaxed, I feel resilient, stress resilient. If something is accelerating my breathing frequency, for example, I'm more alert. And in an alert situation, I'm attracting a part or an aspect of my vegetative neural system, this balance between sympathetic, fight or flight, or parasympathetic, rest or digest axis. With an acceleration of breathing, I attract the sympathetic axis. That comes then with a higher performance of cortisol, that is leading to a metabolic change and insulin resistance, or adrenaline. And both are in conflict with my ability, for example, to regenerate, to digest, to be fertile. And nowadays, those are the big topics that people are eager to optimize. We are talking about longevity. Longevity has something to do with not only surviving, but we want to live well, and healthy. The health span should increase, and therefore we need to reduce inflammation. Therefore, we need to improve digestion, nourishment, and mental health. And that is the cool thing. if the posture is changing because of, for example, Mayr therapy, a little bit of fasting or caloric restriction, a little bit of educational training, a little bit of cleansing of the cells, it's not about losing weight. It's about creating a circumstance or an environment for the cells to tidy up themselves, inside, the autophagia. And with that, we improve the functionality. Life is getting easier.
Can you please explain the concept of auto-intoxication? Because, how does undigested food in the gut actually can poison our system and lead things to brain fog and skin issues and etc.? Like, it's a weird thing because, everything actually we're talking here is highly spoken out there in functional medicine. The wordings that you guys use are very striking, like auto-intoxication.
If you mention auto-intoxication, this is something that is beautifully proved and established for not only decades but centuries already. The problem is just it is forgotten a little bit. We nowadays don't call it auto-intoxication anymore, but modern medicine calls it the auto-brewery syndrome, for example. Auto-brewery syndrome. Wow. Because they found out that if someone is having a fermentation issue, that means if someone is consuming carbohydrate-rich food more than he or she is able to digest. And here, just to make clear, what I digest to break food or to break molecules down to the size that I or my intestinal cells are able to absorb them. Either actively or passively. To then, once that they absorbed it, deliver it or offer it to the tissue, and from there through the lymphatic flow or through the venous system, bring it and transport it to the liver. The liver is checking it, is transforming it, metabolizing, and then from there it's going to the rest of the body. So for digestion, I need to be able to break it into very small into very small structure. In other words, down to the size of single molecules, if you think of, for example, amino acids. If I'm consuming more than I'm able to digest, with the help of enzymes, with the help of physical breakdown of stomach acid, for example, then this food or these ingredients remain unabsorbed inside of my intestine. And my intestine is a muscle hose. It's inside the body, so it's warm. It's moist, it's dark, and full of bacteria. We call them the microbiome. And if I offer to a bacteria a pre-digested food, that means something that is warm and moist, and this in darkness, then we all know what happens. This is the same thing that happens on the compost. There it ferments. It can also happen that something like decay is happening. If I, for example, haven't had a
tooth decay happens, a decay in the gut.
Exactly, with the same toxic substances that are produced by that. And those substances, let's think of cadaverine. Cadaverine is the dead body toxin. It's produced if I had, for example, too much of tofu yesterday in the evening, more than I was able to digest, and then bacteria break it down, and some of the metabolites that are then produced, because the bacteria nourish themselves from the tofu, but they also poo, like I would poo, but they poo inside of my intestine. And this intestine was designed to absorb, and they poo a molecule out that is problematic, and my body is absorbing the molecule, and it finds its way into the tissue.
So it's not basically leaky gut we're talking about. We're talking about something totally different. Wow, that's fascinating. So let me rephrase. So basically, if we eat more than we can digest, there's a food residues sitting in my gut, and that becomes, in that darkness and moist with bacteria, it doesn't especially turn into something good. On the contrary, it can be something...
It is the bacteria feeding itself on it. And if a bacteria feeds itself on it, it also has a metabolism like I have, and it creates poo and urine and those metabolites.
So the bacteria eats the residue that cannot be digested, and then the bacteria has to release the waste, and that waste is toxic. Kind of.
Part of those molecules are super toxic. If you think of, for example, ammonium that is produced, ammonium is one of the strongest neurotoxins that we know. And we know that ammonium is a gas. And with that, trespassing the surface, no matter if the surface is healthy or not, and is finding its way into the body. And I can measure then in the urine or in my exhalation if there is more ammonium. And everyone says, hey, do you have a drinking problem, for example? Do you drink too much alcohol because of your high levels of ammonium in the blood? This person says, no, I never drank alcohol, but I always have for dinner a big portion of yogurt, because I've heard yogurt is so important. There's so much of casein inside, this protein that helps me to gain my muscle mass, for example. The problem is just if this person was not able to digest all of this yogurt, it is feeding decay and fermentation bacteria.
Tell me what happens next. It gets into our system, or it sits there, it's toxic? What happens?
It goes into our system. There it gets transported to the one big organ, that is our guardian when it comes to intestinal, to absorb things in the intestine. And this organ is the liver.
Okay.
And the liver is detoxifying it, transforming it.
So that's why it's like the fatty liver disease and etc. happens?
This is why there's a fatty liver disease. This is why the liver is sometimes swollen, especially if we are feasting a little bit more. But it can also shrink again once we are not feasting, but for example fasting. The liver is changing its size like a muscle that has to sometimes work harder, and then it grows, and then it works less hard.
Okay, then it goes to the liver. And what happens then?
If the liver is able to detoxificate it, it is then transporting those pre-metabolites ready for excretion to the blood, and the blood is then filtered in the kidneys and we are getting rid of it. Or it is filtering into something that is, for example, lipophilic, that is fat-loving, fat-soluble, and is shifting it again into the bile liquid and excreting it through the bile into the intestine. Or the third aspect is it is not able to detoxificate it and is just releasing it in the blood. And voila, you have the autobrewery syndrome. For autobrewery means the following. If I, for example, drink in the evening a good glass of a ripe and freshly and organic pressed grape juice. Or not grape juice, I drink pomegranate juice because I've heard it's good for the sugar. So I drink my pomegranate juice, and this juice is containing more fructose, more sugar than I'm able to digest. So the sugar will stay inside of the intestine, bacteria ferment it, and through the fermentation of sugar, we know it, they produce wine, but not a cultivated wine, but really wild alcohols. Those alcohols penetrate, the ethanol, penetrate our intestinal skin. They are transported to the liver. The liver is detoxificating it into sugar. But that's an effort. That costs me energy. And suddenly I have then more sugar in my blood circulating. And the body says, hey, do I need the sugar? Do I don't need the sugar? When I had my pomegranate juice, this was shortly before I went to bed. So my body is not interested now in sugar to be used in the muscles, for example, and the brain. And it says, we don't need the sugar. So let's detoxificate the sugar into something else. Into fat. And this is why someone who is, for example, eating just salad or just a juice can put on fat, and can create and grow himself a fatty liver, a non-alcoholic, but a food-related fatty liver, just because of eating more of the good and maybe also sometimes very alkaline food than he or she was able to digest.
Wow, that's okay. We should continue on this because this is very interesting. It's going to be interesting everyone because, it has nothing to do with a center or a medicine. It is like so how do we not eat more than we can digest? Portions?
That's pretty simple. Also, digestion is labor. Yeah, it is a labor. It is a challenge. It is something, it's an effort. It's not coming just by itself.
Okay.
So doing some labor, I need to create the opportunity to save energy for this labor to be executed. So take a seat, arrive and put your awareness on the food. Start eating. smell on it, for example, have this first bite, put it into your mouth, lean back, let your fork and knife go, chew it properly, and your body or the moment will surprise you and allow you to experience something very beautiful, because you get really in touch with the food and you get a body feedback. And this body feedback is, oh, that's either so good, or the body feedback is, I thought it might be good, but now it somehow does not fit to my expectation. Yeah, it suddenly is a little bit suspicious or not matching with the moment.
All right.
Yeah? If you, in this situation, it's like with a rendezvous. If I get to know someone for the first time, if I feel very comfortable in this situation, I will continue with the rendezvous and will be maybe also considered to start a new relationship or to start a relationship or a family then later, because that fits so well. If on the other side, my instinct is telling me, somehow the smell or somehow the taste, that is not a match. Yeah?
All right.
Stop it then. Yeah, and avoid that you're burdening yourself with this not perfectly matching relationship. So with the food, have the first bite small, chew it properly, trust your body feedback if it guides you to say, hey, I will continue, and stop then the eating the moment, for example, this breath appears. Yeah. Or when the food starts to get boring. Yeah? When the human animal inside of me always tries to instinctively guide me to survive.
So you're basically telling people needs to trust their gut. That's a lot of expectations from someone. So you say that first do this, whether you like the food or don't like the food. Let's simplify the wordings. And if you don't like it, if the taste doesn't feel great, just don't continue.
Exactly.
Put it aside. If you like it, then you start eating. But if you like it so much, then you want to continue eating, what happens?
This is something,
you know what I mean?
This is something people nowadays need to train. Food or eating in my daily routine should not excite me, yeah? Should not entertain me. Food is an aspect of living, yeah? And therefore, it is a responsibility and also a duty to successfully deal with it.
You think that so what you're saying is that you have to eat the food to live. You don't need to live to eat.
Exactly. The cool thing is we are celebrating festivities from time to time where we do it completely the other way around.
Maybe us time to time. I know a lot of people when I kind of share like, okay, eat this first, or, you have to eat based on your needs. If you have osteoporosis and if you need to build muscle, you really need to eat, like heavily rely on protein. You cannot just eat just vegetables. And then, people react to me, oh, you don't enjoy life. So people enjoying life is like food and joy of life. It's kind of hand to hand for people.
Exactly. And they forgot or they were not able to experience for a longer period of time what is life about. Life is about to feel alive. If I nourish myself with a meal that I'm able to digest perfectly, I feel more energetic, more alive after the meal than before. And that is a blessing. So many clients that I meet are telling me, hey, I don't know what to eat. First of all, it gives me a stress because what is the perfect composition or choice? Number two is I have no time for eating. Yeah, what is a pity, because eating and nourishing myself is giving me the confidence that my decisions are protecting me, supporting me, are nourishing me. That is a cool thing. Third thing, if I eat something that is yummy, it's a joyful moment. Fourth thing, it is a moment of contemplation. It is a moment of awareness. 3 moments, 4 moments of awareness a day are already improving, also from a scientific point of view, my well-being, my longevity, reducing the mortality.
But you also are saying, with all these nice words, you say you shouldn't treat food as an entertainment, as something to enjoy, but you have to realize that food is there to give you energy, and surplus of it apparently is turning into a toxic burden to your gut, therefore to your liver.
If I'm in my clinic or my colleagues also, for example, we are dealing with clients that are very often highly educated when it comes to what is the perfect diet. And they come and I ask them, okay, what do you eat? And they say, hey, I only eat healthy stuff. And then they name it. And I have to say, yeah.
Let me jump in for a very quick second. If you can hear me right now, we know you're watching Soberhead. But are you subscribed? Could you check it for me? Very honestly, our subscriber count gives us real leverage when it comes to convincing the guests we invite to join the show. So, if you want to keep watching some of the best experts in their field right here, please subscribe to the channel.
Wow, fantastic. But why is it then that your body and your mind is such a mess, although you are eating so beautiful things? Because you missed one thing. You can eat ambrosia, the food of goddess, and turn it into a torture if you are not able to digest it properly. And
so let's help people what they should do. First, you said that, just lean back and listen to yourself, whether you like the food or don't like the food. If you like the food, then continue eating. And you say is that
once you feel bored, stop the meal, and
what if you don't feel bored and you keep eating?
Yeah, and after the meal, you should feel more energetic, for example, than before. Simple test I do with my clients. They should climb the stairs prior and past the meal. And if climbing the stairs after the meal is more strenuous than before, they overate. Then I give it a few days of practicing for them, and they will suddenly recognize, those little nuances. When is my hunger? When is my need satisfied? Yeah. When am I starting just to entertain myself? Few things they need to first experience before they can believe it.
I think also the chewing 40 to 60 times has a place in that digestion.
Beautiful clinical observation, for example, people who are chewing better, have a better cognitive outcome. They did trials like that with people suffering from Alzheimer's dementia. So they just put, for example, they altered the consistency of the food to make them chew more. And with that, the cognition became better.
Wow.
It was not able to heal the Alzheimer's, but the well-being was improved.
How?
There are two aspects. Number one is you are activating, because of that, a different form of the autonomic nervous system. Number two is you're producing more saliva. Saliva is not just liquid and moist. Saliva is the material that is containing the enzymes, for example, to digest better. Saliva is, in the right composition, also the environment for the friendly bacteria. If you have friendly bacteria, you have less decay or, for example, fermentation, less ammonium, for example. Aspects like this. Chewing is a form. It can be your salvation if you are in a very stressful environment. If you say, I insist in chewing my first bite till the bite is completely liquid. Once it's liquid, I swallow it. With that, you slow yourself down. You alter your breathing. You breathe through the nose. With that, you have a higher amount of carbon dioxide and nitrogen oxide, for example, flooding your blood circulation, relaxing your vessels. You have an anti-inflammatory and analgesic effect. You feel more confident. You feel more positive. And this is then the perfect nest experience for you to digest and the next few bites, well chewed, much better. And you nourish yourself almost by its own. Yeah, it's not an effort anymore.
You guys also have that rule, almost, no raw food after 4 p.m. What's that about? That's very difficult. All these things that, Mayr Medicine is expecting is tough.
The more complicated it is, the more simple you should treat it. If I have someone who is ill, this person has not a lot of energy, neither to digest nor to repair. Still it needs to get nourished. So I will offer them food that is very easy to be digested. We know it from baby food, for example. A baby, although a fruit salad would contain a lot of antioxidants and vitamins and everything, yeah? But I will not give a baby a fruit salad because it will then start crying all night long, most likely is bloated, is just ill. I will give the baby a little bit of oat bread, for example, because then the oat bread is making it necessary for the baby to produce the saliva, digest it already inside of the mouth. The baby is calming down, for example, and is turning what it is eating into just benefit. Yeah. With almost no metabolic and side products that are unfavorable. And this is also with the raw food in the evening. At the end of the day, I'm not as energetic and as strong in my digestion than I maybe was in the morning.
Okay.
Yeah. So if I then eat something that is already pre-digested, like processed, like cooked, like fermented, it needs me to put on much less energy in turning that into gold and energy and nutrition for myself compared to something that is raw. Raw means it is unprocessed. It is the most difficult, for example, to get digested. Raw, we have a huge tradition in mankind of how to process foods to make them digestible. If you think of what we are doing with grains, till we can benefit of it. Or also, for example, when it comes to vegetables or leaves, we cook them, we boil it. Why? Because my grandmother or our grandparents were observing by preparing the food like that, by boiling it, they make it more easier digestible. The society is then benefiting from it. Nowadays, we know it has something to do with the lectins, the anti-nutrients. There are some structures inside of for example, leaves that make them undigestible for me as a mammal. I can destroy them.
I did a podcast with Stephen Gundry.
Oh, super.
We discussed there a lot about that and how in the old days there was a lot of, soaking of almost everything, the quinoa, the beans, the lentils, and etc. And actually in Turkey, we used to do that.
Yeah, that brings me to another point, for example. Nowadays, we know it would be so beneficial if our meals are higher in fiber. Yeah? The problem is just if I consume the recommended dosage of fiber and I'm not used to it, I'm just not feeling good. I'm not looking healthy.
So basically, though, you're saying is most of these expectations are for kind of in the unhealthier people. It's more important to follow these rules than super healthy, because let's play this scenario, like no raw food after 4 p.m. Well, I mostly what I do is if I eat raw or what not raw, I for sure hop on my treadmill after the meal and walk half hour, if I have time, at least an hour.
In what intensity?
Not too intense. No, not like jogging, because I do work. I have a treadmill that I can work on it. So it's not like out of breath. It's more like maybe 4.5 kilometers per mile. But what I'm trying to say is, would it help my digestion? Because there is a lot of saying like that, especially for the blood sugar.
With all the respect, before we started, I mentioned something on you with your posture. It is digestion is labor. And the digestion process is not finished the moment I end up swallowing my food. Then the real digestion happens. The physical digestion, the breakdown inside of the stomach, the chemical transformation inside of my small intestine with the enzymes, the microbiological interference with the preforms of the nutrients, and then the absorbance, and then the drainage back to the liver. So again, when you stop eating, the digestion, you finish the moment, or you stopped the. When you swallowed, you ended the aspect of digestion that you were actively able to put control on. Everything else is now going to happen, and it takes time. If you think, for example, of a fatty meal that is like, for example, a cheese fondue, yeah, that stays inside of the stomach for minimum 4 hours.
All right.
4 hours. 4 hours where you didn't absorb any nutrient, where the
I don't think there's much
digestion.
nutrition in a cheese fondue, regardless whether it's set or not set.
Now think of a salad. How long will the salad remain inside of your intestine, in your stomach, till it is turned into liquid? Because only when the stomach with its motility movements is sensing, the content is liquid now and there are no corpuscles, it is opening its exit and allows then the content to rinse into the small intestine.
How long?
Depends on how well you chewed, but 1.5 to 2 hours. If in this time you start then to perform, again, your performance requires energy. This energy that you now put on the performance is maybe lacked and missed inside of the intestine. And with that, it makes it then more likely that what you just consumed was not digested properly. You have a little bit of fermentation, gas production.
Because
we have a saying in German, for example, after a meal, you should either rest for an hour, and make a nap, or you go for a walk, grandmother style.
That's slow.
1,000 steps. Yeah, this is a saying. This is an observational knowledge.
Okay, so basically what you're saying, if you spend your energy to do the body work, workout, whatever, then you're going to stop the energy consumption of your stomach.
Vegetative nervous system. Either you are a performance monster or you are a digestion monster. To be both at the same time is just not possible.
So basically what you're saying, walking is not going to help your digestion.
If you walk gently,
would it?
It is of course then helping because it is an active rest. While I'm walking, I'm not responsible, I'm not fighting, I'm not creating the world.
All right,
yeah?
And how can it help for the digestion?
It can help for the digestion because while I'm walking, my metabolism is optimizing. I'm producing a good amount of carbon dioxide without accelerating my breathing. Yeah, with that, I have a fantastic blood circulation in the gastrointestinal system. All the organs are involved in the digestion are now metabolized and well blood circulated. And the other organs that are in competition with the digestive system, like for example the brain, are at the moment while I'm walking is boring, are not in competition anymore with the food. And the nice thing is, this is a really boost for acceleration to digest your food to the fullest.
Oh yeah, okay, a lot to learn. Chew a lot. Don't eat more than you can digest. So basically taking small portions to your plate, I think would make you not eat more than you can digest.
That would make it a little bit easier. But again, observe fully. If you digest properly, if you chew properly, you will be surprised of how little you need to get nourished and satisfied. And that's blowing the mind of so many people. I'm working a lot with athletes, as professional athletes that are really focusing on maximizing their strength. And if they are turning into chewing monster, they can hardly believe of how efficient they can be with little food. Yeah.
That's great. Let's jump into this. Another fascinating thing you guys do at Mayr, at VivaMayr and with Mayr Medicine, the muscle test, the applied kinesiology. Explain it, because when you guys have clients coming in, you're testing them with a certain way that you're going to explain now for their food sensitivity, correct?
For example, it is this form of testing or the functional muscle diagnostic is not part of the Mayr Medicine or diagnostic and therapy according to Mayr. This is a characteristic that we are using in VivaMayr, for example, as a diagnostic short track. Look, I love to do genetic testing. I love to do proper metabolome testing or microbiome testing. Or, all those tests require a little bit of time.
Sure.
And if I have someone that arrives and that visits me in VivaMayr, he or she wants to start right now with something.
Sure.
And I cannot say, hey, look, I get the results in 3 to 5 days. So we start with the therapy in 3 to 5 days. He or she wants to start right now. And we discovered that this form of functional Mayr diagnostic, if you use it in a medical and a very appropriate way, makes it visible with a very high certainty of what is doing good on someone, on a person, and what is causing irritation.
Let's explain what it is, though, because it's an applied kinesiology. Basically, it's a manual muscle testing.
It's a manual muscle testing. A muscle is able, a single muscle group, for example, a single muscle is able to produce a certain strength,
Sure.
maximum strength. And we measure together, either with an oscillograph, that would be the technical, physical method, or just with the sensation, with sensing the strength, the maximum strength of this muscle. This maximum strength of this muscle is representing the situation the person is in right now. Yeah? If I'm feeling like a vegetable, I have not a lot of maximum strength. If I'm feeling good and well slept out, I have a good amount of strength. But I can always produce just this maximum strength. If I then introduce into the system by pressing an acupuncture point, for example, that is representing a meridian with some organs, for example, this chain of organs is not the right company for the muscle, for example, to be super energetic, but suddenly consuming also a little bit of energy, the muscle strength is changing, experienceable. And that is quite a surprise. I was working in London a lot with rugby players, guys with upper legs like this, and too strong for me to bend them. But if, for example, I put in one of those guys the finger on a particular organ point, let's call it, for example, the heart. After the training, I put the finger on the heart point. Yeah, we call it a Magen 25 point in the traditional Chinese medicine. And this guy is suddenly not able to perform anymore. Yeah, he's blown. If I then in the situation provide a little bit of potassium and magnesium on the tongue, just to inform the system, and we put the finger again out here, and suddenly the muscle is strong again, then it is from a physiological point of view, it absolutely makes sense. After training, he or she is exploited from potassium and magnesium. They are drained. Yeah, and with that, you have an electrolyte issue. You can also do that also with foods, and what you identify with it is just a simple thing, not more, but also not less. This food is making me strong and allow me to perform. And this food is right now, in this moment, not a call and a spell for eternity.
But you didn't explain yet what you're doing.
What I'm doing, I'm always testing the strength of the food.
I understand, but you didn't explain how.
No,
I mean, for the audience. You're explaining me.
For example, if I want...
give an example, what you guys do, what you do with the food so that you understand. So that's what.
I want to understand the strength, or I want to measure the strength of a single muscle. Therefore, I need to know the anatomy. And for example, if I want to know the strength of the pars medialis, of the musculus quadriceps femoris, I put the person on a bed, ask him or her to raise the leg to 90 degrees in the hip and 100 degrees in the knee. And then if this person is trying to push his knee, pull the knee toward the nose, then I know that this strength that is here now performed is just the musculus, the pars medialis of the musculus quadriceps femoris. If in this situation I recognize, this strength, and I add then a special food, for example, on the tongue. So we change the environmental situation for the human body, for this muscle then, and I test again, and the muscle is suddenly not able to perform the same strength. Then this is surprising to the client and is explainable by saying, hey, some companies are just consuming energy. And a company that is consuming energy is not necessarily a friend.
Let me rephrase, because you're explaining wonderfully, too technical. And it's way too technical. I believe that nobody would be able to understand before I explain more. So basically, you guys, to the clients who are arriving to the clinic or to doctors who are practicing Mayr medicine, what I learned is that you guys are testing on that client bunch of foods, minerals, anything that one can be experiencing maybe an allergic reaction in a way, or their system is not tolerating well. So that's what I learned, not learned, but I heard.
Right.
You guys put that under the tongue on the tongue, and then testing the person's muscle like you were describing, and if that food works for that person, the muscle is strong. If it has reaction to the system, then the muscle doesn't have the power. Is that correct?
The muscle is then reacting in a different way. This is correct. This is, again, this test is not the holy grail of medicine, and it's not the internal truth. It is like an assessment of the moment. When it comes, for example, to my concern, there might be an allergy, then I will also do a proper blood or prick test. This is clear. I'm a physician.
Sure.
I'm not just doing things. But to avoid this try and error experience, it turned out to be such a fantastic tool, because when it comes, for example, to immunologically triggered food intolerances, with this test, we are reaching almost 90% of accuracy. And that's cool. And we tested then and compared then also with, for example, the blood test. If you are not able, or if you're not willed to do that, I told you that this is a VivaMayr aspect and is not part of the Mayr Medicine or diagnostic and therapy, according to Mayr, that we train to our physicians. But if you are practicing that, it can be, it is on one side a wow effect for the client, what is good. And on the other side, it is making my life a little bit easier, but it still requires, and I only execute it because I know I see my client also the next day and the day afterwards. So my recommendation should prove to, for example, turn out into a beneficial change in the posture. Or the well-being, or the intestinal health, or the amount of gasiness, or hardcore, for example, I want to see the right metabolites in the urine. I don't want, for example, the ketogenic bodies to go crazy. I want them to show a fantastically efficient metabolism.
A few more things that I'm curious about, because in the studies out there's not much evidence that, because I know from my friends as well, and I know there's other clinics in Turkey that, they insist on alkali. Everything is alkali. You have to drink alkali water, which tastes horribly. And then the stomach has acid, so that alkali doesn't stay alkali when you drink the water. So, I mean, how valid to eat alkali to make somebody's system better? Because I did enough research. There's not much outcome on alkali.
If you allow me to break it down to something. Acid is part of life.
Sure.
The most acid thing in life is not so much what I eat, but how I live. If I live my life like a performance monster, I'm just metabolizing to a degree that I produce acid metabolites in high quantity. And this is then the job of our body to keep the homeostasis, this balance, and for example, to build an aspect known in chemistry that is called base excess. How stable is my blood to be kept in its short and very narrow pH frame that is expressed by the base excess. If someone is, for example, starting to, in his daily routine, to breathe always very shallow but quicker, this person is changing the base excess in a not adequate way, not in a beneficial way. And because of that, if this person is continuing like that, it is then not only the breathing altered, but then also the metabolism of the bone health, for example. You are decarbonating your bones. It can lead to osteopenia then over time and with the years. This is where the idea of feeding someone then an alkaline food is coming from. Because if someone is having a problem to keep, for example, the base excess in a very balanced way, how can I provide alkaline entities? And here, for example, root vegetables, the classic vegetable soup, the minestrone, like they enjoy in Italy, or the beautifully little cannabis that is part of the Turkish breakfast, for example, olives, super alkaline, nice. But they are not or almost nothing compared to my lifestyle. So if I live a life on fire, I require a little bit more rest to keep that in balance. And to think that alkaline water or alkaline foods can be strong enough and beneficial enough in their effect to make this happen is just overestimating of what food is. Food is nourishment. Best possible case, if I think food is the solution and I just have to have more food to reach my aims, it very often leads to indigestion, and then you turn the alkaline food into a fermentation problem.
Yeah, I mean, exactly. So I'm glad that you explained it, because, there's a lot of false information out there that, people push on you, like, oh, you have to, like alkaline, such as example.
We are all looking forward for the easy solution. And the easy solution should be something that we are able to consume.
I did an interview with that person who produces machines and stuff, doctor who is very knowledgeable on hydrogen water. And to him, actually, I asked about alkali water, and he says it's a bullshit thing because, the minute you drink that alkali water, your stomach is acidy, so that's going to turn into an acid.
The interesting aspect about that is, why is our body a little bit acid? Because it is a barrier. It should be a chemical barrier that bacteria, for example, from outside that are maybe not as favorable for us are not trespassing this stomach barrier. So after neutralizing the stomach acid, our body is trying to build new stomach acid. And as it does so, as it is not coming out of nowhere, our body is splitting something neutral into an acid part, and that goes then outside of the body into the stomach, and the alkaline part remains in the blood circulation or in the cell. So with a little bit of an alkaline water, you of course can alkaline your body, not because you absorb alkaline stuff, but you could make your stomach react on the necessity to build new stomach acid. Again, that is labor, that is work, that is something you need to be able to perform. And if you are exhausted or ill, it can be that you are acid, but you are not benefiting then from this alkaline interference because your stomach is just not strong enough. That can be treated, for example, or positively affected by the intake of zinc. We need this enzyme that makes that happen is zinc related, the carboanhydrases. And if someone is zinc deficient, like so many people in Turkey, we do there a lot of testing in the blood. That is playing a role.
How do you feel about the colon cleanse? That's also for, it's, there are mixed messages about it. And I do not believe that by itself, it's helpful for the detoxification. There's not much proof on it either.
If the intestine is healthy, the intestine is able to clean itself very properly from old food residues and stool. Super. If the intestine is healthy, it is able to, as a hose, make this, and when it opens again, it's clean. Like I was watching today in the morning, the people coming from the ferry, for example, there were a few bellies that were not demanding, not big, but they showed that their intestine seems to not be able to do this anymore. So the surface remains not completely cleansed, but a little bit polluted. Under circumstances like this, it would be nice to just rinse the surface with water. A hydrocolonic therapy or colon hydrotherapy is focusing on the very last 2 to 3 feet. That means the very last meter of the large intestine. We have a length of 7 to sometimes 9 meter of intestine. So we are just talking
Imagine that's fitting inside. And if it's not clean, obviously you will have a belly because 7 to 9 meters is a lot.
And the problem is, and you mentioned it, the auto-intoxication. If what is inside is not nourishing me, but is nourishing bacteria, it is exposing me to bacterial metabolites that are causing irritation, intoxication, inflammation, physical, endocrinological response on it, that are binding and occupying energy and limiting my ability to experience life as to be beneficial or friendly. So if I then with a hydrocolonic therapy, with an experienced therapist, are just rinsing the surface with simple water, the last meter, and allow then this water to dilute whatever is sitting on the surface, and then to be transported out of the intestine, not with force, but just following the gravity. There's nothing bad about it from my perspective. And some people say, hey, you are altering the microbiome. Look, I'm doing that with people who are having a problem in their intestine. They are not able to clean itself. This person is having a microbiome that is not ideal. So if I reduce there a little bit the numbers, this is one thing. Number two is you have a lot of bacteria in your mouth. Sure. Do you think drinking water is making you here sterile?
That's a good
Okay. So
let me jump in for a very quick second. If you can hear me right now, we know you're watching Soberhead. But are you subscribed? Could you check it for me? Very honestly, our subscriber count gives us real leverage when it comes to convincing the guests we invite to join the show. So, if you want to keep watching some of the best experts in their field right here, please subscribe to the channel.
It is also not the solution, but it
you wash it.
Exactly. It is not the solution for everything, but it can be used in the right way, in the right moment, as a proper therapy to help an intestine to get a little bit rid of some burdened substances, whatever, old stool stones or whatever, to get rid of them before time.
We wanted to also talk about oxygen.
Oxygen. Oxygen is necessary, but and we would normally expect that with our acceleration of breathing, we just gain more oxygen, what is true. And because of that, we would feel more energetic. The opposite is the case. People who are breathing too quick have higher blood pressure. People who are breathing too quick have higher likeliness for brain fog. People, for example, their brains are swelling, and because of that, they have a high likeliness for migraines or headaches. They have their body temperature drops, what is interesting. They have a higher oxidative stress inside of the body. They age in advance. So it would be nice to practice a form of breathing where we keep the oxygen acceptable high, but increase the carbon dioxide on the other side, because following to a physical law, it's the Bohr effect. Our cells or the molecules oxygen and carbon dioxide are exchanging the quickest if carbon dioxide is high in concentration. And this is easy to be executed if you think about, for example, eating. If I, while eating, shut my mouth and don't entertain the others, but just chew, I breathe through the nose and I slow down my breathing frequency. With that, I address all aspects of myself in a positive way because the carbon dioxide levels raise. I oxygenate, or I have a better gas exchange, and this is good. It makes me calm, it makes me happy, it reduces pain, and it is making my digestion become better. The same thing also with your exercise. If after the meal you go for a walk and you do that with your mouth shut, you choose the right intensity to be strictly aerobic, and with that you are not interfering and asking for forces and labor that you now need for the intestine to be reserved.
So you shouldn't be walking and talking.
Walking and talking is something that is good for entertainment and in between.
Not for health reasons.
Exactly.
Thank you so much. I really learned a lot. In my opinion, if I was even thinking like that, there was a misconception of VivaMayr of it's a diet place. It's a place for people to lose weight. With everything I learned now, it's actually more education, healing, creating a new lifestyle in a way.
Thank you very much for beautifully summarizing that. And this is then also pointing to another mistake or misunderstanding sometimes. If I can adjust my lifestyle in a favorable way, making it a new lifestyle, time is required. If someone says, hey, I drop by for 3 days, you heal me, and then I leave you and I'm a new person. that is a misunderstanding. Then the client will never be happy. If someone says, look, I'm confused by all those good advices and by the fact that the good advices are not affecting me in the way I'm expecting them to affect. Let me experience something different and guide me through this experience and educate me through this experience. Then this can turn into a life-changing starting point that is then not only lasting good for a week or 2 weeks or 3 weeks, but suddenly for months. It will always contribute somehow with our lifestyle or the lifestyle of the others. But hey, that's life, yeah? But if you once learned and understood of what it is about when it comes, for example, to digestion, and that you should feel after a meal better than before, and if you're not feeling better, there are some aspects that you can focus on to observe then the opposite again and something beneficial, then you are empowered and to self-responsible and with all your personal freedom, live your life long, happy, healthy, and with as little inflammation as possible.
One last question that I have, like while you were talking, I thought I didn't ask about protein intake. There's a lot of messages out there. I mean, some say a lot of protein, some says do not eat that much protein. I'm not going to ask about how much one needs because it depends on their own need. I'm going to ask about the timing of it. Because if you cannot digest salad or raw food, how are you going to digest some big steak?
For example, so big steak is always difficult to digest. Yeah, but for example, a steak that is well prepared is easier digestible, for example, than a bowl of lentils. This is it, yeah? And the form of protein that you find inside is leading to a longer satisfaction inside of the body. This for sure. But, and here I agree with you, and this is maybe the missing link. If I consume protein in a quantity or in a setting where I'm not able to digest this quantity of protein, it will turn into an enemy and bite my ass. Yeah. And then I have decay. And the decay metabolites are really, they are not just disturbing, they are painful. It is histamine, it is ammonium, it is those biogenaamines, for example, that are normally used inside of my body to signalize inflammation. Yeah. And with inflammation, we were talking about hormones as well, or also the emotional state, for example. If someone is inflamed, Soberhead and inflammation is not going well together. Yeah. So if then a nutritionist is nowadays recommending you to have a good amount of protein a day, please break it down to 2 or 3 portions. Yeah, that are then fitting and suiting maybe your digestive capacity at that moment, and chew it to the fullest and stop it the moment your senses are telling you it's not interesting or it's starting to become suspicious. And you will be best guided. The recommendation, for example, nowadays for the elderly above 70 is that they should have 35 to 40 grams of pure protein with each meal. That would be around the equivalent of 6 eggs with each meal. If I think of my grandmother, she's now 95. Ooh, I hope she's healthy. Yeah, maybe. If she would have to eat with each meal 6 eggs, I doubt that she will have a good bowel movement the next day. Yeah, or that she benefits. But if she is increasing maybe a little bit the intake frequency of the proteins, or have a little bit of protein with each of her meals, size of what she's able to digest, she will benefit from it.
Thank you so much for your time. Mine told me so many times that I should go to VivaMayr to experience it. I think this podcast convinced me more to come there and to experience myself and learn more, actually. It's difficult to learn in 1 hour. If one stays there for a week or 2, then there's a lot to learn.
I would be very happy to work with you for a time span of 3 weeks.
3 weeks. Or I should carry my podcast studio there.
Yes, of course. Yeah, you will meet a lot of very interesting people there.
Thank you so much.
Thank you for your open mind and your sense of adventure.